It's humid.
Hello. Hello, everyone. Good morning. Thank you so much for joining us today. I am Kayla Bowen, Digital Marketing Specialist for Byram Healthcare, and I'm joined by Gary and Tavia. Um, Today, we will be talking about self-care and self-improvement with living with diabetes. Byram Healthcare has been a national leader in patient direct medical supply delivery for over 50 years. We've been rated the best overall diabetes supply company by Verywell Health for 4 years in a row, with an A+ rating with the Better Business Bureau, and we're your trusted partner in diabetes management. At Byram, we know that life takes care, and today's conversation is one way we are fulfilling that purpose. Before we begin, please note that nothing stated today is intended to be a substitute for professional medical advice, diagnosis, or treatment. Our discussion is for informational purposes only. Always seek advice from your healthcare provider for any specific medical conditions. So let's start off with some introductions of our guests. We have Gary, an award-winning certified diabetes care and education specialist and exercise physiologist with a personal connection to type 1 diabetes since 1985. Gary, would you like to further introduce yourself and tell us a little more about the work that you do?
Sure. Did you notice I did my hair up special for today?
Yes.
You like that? Well, I got into this field primarily because of my personal connection, having had type 1 diabetes since my early years in college. I've gotten to the point where I've built up a practice that features 9 of the best diabetes care and education specialists in the world, as far as I'm concerned. And we focus primarily on coaching people on intensive insulin therapy to manage their glucose levels effectively and just achieve whatever goals they happen to have in mind. Teach them all the latest and greatest self-management skills using all the latest and greatest tools and technologies that are available. I've been using DIY open source systems personally for the past several years to manage my own diabetes. I'm a bit sports obsessed. I'm in Philadelphia. I love my sports teams, and I work out almost every day. I play basketball a few days a week. I don't look like it, but I really do play basketball. That's it. I do a lot of writing on the side. Think Like a Pancreas is a book I put out years ago, and working on a new edition currently. So I'm excited about that. And I've got 4 kids, been married for 35 years. Got to do the math in my head.
Aw.
Yeah.
Wonderful. Yeah, Gary is something of an icon in the diabetes community. I think his book, Think Like a Pancreas, has had such an incredible impact on the community and really enabled people to take better control of their lives living with diabetes. So we're also joined by Tavia, a registered nurse and certified diabetes care and education specialist with a personal connection to type 1 diabetes since 1981. Tavia, if you'd like to further introduce yourself.
Sure. Yeah. I joined Integrated Diabetes Services a few years ago now. Can't believe how fast time passes when you're having fun. I've been a diabetes educator since I was pregnant with my oldest son, who is now 16. So I can keep track of how long I've been in the arena of diabetes education from this side of the table. And I specialize, I could say, it's an area of focus where I have a great passion, is working with people who are Spanish speaking as their primary language. I work with people in English and in Spanish with primarily type 1 diabetes, but any type of diabetes that requires the use of insulin therapy. And I work with young children and their parents and family members on up to aging members of our diabetes population, our diabetes crew. and work with people who have challenging, let's say challenging situations, whether it's transitioning from living at home with parents to going to college, or it is trying to juggle working a 2-shift type job or 2 or 3 jobs and fitting diabetes in, or other health issues, which can make management of diabetes super complex based on different medications or feeling unwell and foggy brain, things like that. I like to, outside of focus every second of every day on diabetes, as I have been known to do sometimes, if not pulled away. I really enjoy spending time with my family, going outdoors, hiking, kayaking, walking with my dog, who is a husky, who sometimes walks me if I'm not careful. And I have 2 kids. They are teenagers, and my oldest, actually, who is now 16, was diagnosed with type 1 at age 12. So I have type 1 diabetes on the brain in about 8 different ways every day and night, really. So that's my connection. That's why I'm here.
Amazing. Well, thank you both for joining today. So we're talking about self-care and self-improvement because apparently September is self-care month. So let's start with Gary. If you would like to discuss self-care practices that help in perhaps detecting and preventing long-term complications of diabetes.
You know, whenever we work with a new client here at Integrated Diabetes, the first thing we want to know is why. You know, why somebody is interested in managing their diabetes better. Is there something specific they want to achieve? And typically, we get responses that are pretty far-ranging. It can be things that have immediate effects, things that have long-term effects. In the immediate term, we know that glucose management affects our ability to function and perform well on a day-to-day basis. It affects our moods and our personalities. It affects our energy levels, our physical performance, our intellectual abilities. So it really does influence how we function day in and day out. But in the long term, we know that glucose levels impact the risk for long-term complications and all the health issues that diabetes can lead to down the road. And for many people, they think it's just blood sugar levels that contribute to that. But the fact is, the long-term complications of diabetes are what we call multifactorial. There's a number of different things that influence the risk for the long-term health problems. Besides glucose levels, it's also affected by genetics. It's affected by heredity. There are certain genes and gene structures that affect that. It's affected by our lifestyle habits, how well we take care of ourselves, and it's affected by our environment and things we just don't really understand yet as well. Now, some of these things are within our control. Obviously, we can't pick our parents. The genetics are beyond our control. A lot of the environmental influences are beyond our control as well. The blood sugar levels are somewhat within our control, and we're fooling ourselves if we think we have total control over our glucose levels. We don't. I mean, we can manage it as well as we can, but it's not completely within our domain. But the lifestyle habits and the self-care, those are things that we do have a lot more self-control over. So those are things that I always emphasize with our clients, is the importance of self-care. And self-care takes a number of different forms. It takes the form of your lifestyle choices, your sleep patterns, your diet, your exercise patterns, the stress, the way you interpret stresses in your life. It also takes the form of lab work, making sure that certain lab work is done in a timely way. And it takes the form of exams and being screened for things early on. Those make a big difference in terms of our long-term risk for health problems. So maybe we could break them into those 3 categories. There's the labs, there's the exams, and there's the lifestyle habits that are involved. So from a laboratory standpoint, when we get blood work done or when we have urinalysis done, there are certain things that we always want to have checked. The A1C that's a blood sugar measure, but clearly that's something that everyone with diabetes should be having checked, usually every 3 months if they're on insulin. Blood pressure is another thing we want to have checked regularly. Blood pressure and blood sugar sort of feed onto each other. When you have both elevated blood sugar and high blood pressure, it causes a lot of damage to blood vessels, and it can restrict blood flow to vital organs. So managing one's blood pressure is critical. There's other blood tests that are measuring lipids in the blood, cholesterol levels, triglycerides. Those need to be monitored pretty closely. I think of sugar and cholesterol together in the bloodstream forming almost like cement. The two separately aren't as damaging as the two together. When you have high cholesterol and high blood sugar, we see a lot more clogging of blood vessels, a lot more narrowing of blood vessels. So vital organs like the heart and the brain and the muscles and the extremities, they're not getting the blood flow that they need when we have diabetes and our lipid levels are too high. Those need to be watched carefully. And there's some other things like, we check for thyroid gland function on a regular basis. Anyone with diabetes should have that checked. And especially for young people, we screen for celiac disease. That's another important lab item to have checked. But key lab items, I would say, the A1C, the lipid levels, cholesterol, triglyceride levels, those need to be monitored pretty closely. From the standpoint of physical exams, just a general exam with a primary care doctor once a year is really important because, they can detect things early. Prevention, it's all about catching things early so that they can be treated and don't become severe. To me, it's like maintenance. We do maintenance on our cars better than we do maintenance on our own bodies. We change the oil regularly, get it inspected, but we neglect our bodies. We don't do the same kind of thing. So a general exam is a physical exam is a great thing to do every year. Other exams include the dilated retinal exam to screen for problems in the retina in the back of the eye. And the ophthalmologist will also screen for glaucoma. They'll screen for edema, other problems that can occur within the eye. But the key is to have your eyes checked when you don't have symptoms, because by the time symptoms appear, usually eye disease is already pretty far advanced. It's already at a point where it may or may not be treatable at that point. But when eyes are examined, when you can see fine, when you have no symptoms, there may be little leakages or hemorrhages in blood vessels in the eye that can be cleaned up. Nowadays, they use lasers to seal up leaky blood vessels and keep them from spreading and causing more damage. So that annual eye exam, it has to be a dilated exam. If you go to your doctor's office and he just looks in your eye with a light, he's only going to see a small portion of the retina of the back of the eye. The pupils have to be dilated to really see the full back of the eye. So that's important to have done. We recommend that you see an ophthalmologist for that. That's a medical doctor really skilled in diagnosing and treating eye diseases. So other than the eye, we want to make sure that the feet are checked regularly, professionally as well. Seeing a podiatrist once a year, even if you don't have problems, is a great idea. Having a podiatrist you can call upon if there is any early sign of trouble with the feet. But there's a test called a monofilament test that almost any physician can perform. Certainly your diabetes physician should be able to do this. The monofilament test is simply, it looks like a piece of a hairbrush, and they touch it to your foot at different spots and bend the filament, and you should be able to feel that. If you can't feel that at certain areas on your foot, it means that you are losing protective nerve sensation. And that's usually the first step in the development of foot problems. If you lose nerve sensation, you could develop injuries that go undetected and grow and spread and become worse. So the foot check is very important. Oral care is another thing that we recommend that people see their dentist a minimum of twice a year. I go 4 times a year. So I just feel it's better to see the dental hygienist and get that really thorough cleaning. Gum disease develops fast and furiously in people with diabetes. That extra glucose below the gum line, it causes plaque formation, and gum disease can develop very quickly. So oral care is really important. And one of the getting back to a lab test, it's not a blood test, but a urine test. It's called a microalbumin. This is a urine test that's evaluating kidney function. There's a specific test called an albumin to creatinine ratio. Now, this test is analogous to doing an inspection on a bridge while the bridge is still working. If you wait until the bridge has enormous cracks and is collapsing, it's too late. This is an inspection of the kidneys in a way to see if there are early cracks forming. There's 2 things that are getting into the urine in this test. There's the albumin, which is a protein. Protein should not be leaking into the urine. If protein is leaking into the urine, is a sign that there are some cracks forming within the kidneys. Leakage is taking place. The other thing that's measured is creatinine, which is a waste product. We want those waste products being eliminated through the urine. So this albumin to creatinine relationship is important to look at. We want that number as low as possible. We want very little protein leaking through and lots of waste products getting through. So if that albumin to creatinine ratio starts climbing, it's a sign that the kidneys are losing their functional ability. Catching it early is critical. Just like with detecting eye problems early, it's usually pretty easy to treat the problem when it's caught early. You catch a kidney problem early, there are medications that can stop it and possibly reverse it. So that's a really important test to have done as well. So from a standpoint of staying on top of your lab work and your physical screenings and examinations, they can be the difference between having a mild problem that can be treated easily and having a problem that is untreatable, and things that can lead to things like blindness and kidney failure and heart attacks and strokes and amputations. So early detection, preventive health is really critical in the diabetes space. Tavia, you got any other thoughts? Anything that I missed? There's probably some items I didn't mention.
Well, if you think about what elevated glucose levels and extremely variable glucose levels do over time to the body, and I'm not talking about a brief moment, an hour or 2 here and there, or every few days there's some above target blood sugars. You're talking about months and years of perpetual, we'll call it insult to the inside of the blood vessels and the nerves. That's what leads to the long-term complications of poorly managed diabetes, is how I like to refer to it. Everyone with diabetes can potentially end up with elevated glucose levels sometimes and variable glucose levels sometimes, a lot of the time. That doesn't guarantee. It's not like the kiss of death. A lot of people live in a very heightened level of a state of high anxiety around the potential for ending up with long-term complications. So just one key point that I think is important is the information that Gary's providing helps people have a structured way to look at their risk. If you get your screenings done, the tests and the labs he's talking about, and they're all completely normal, hopefully that can help if you are dealing with a high level of anxiety for those long-term complications, because they don't just show up one day. It's not like somebody has perfectly healthy blood vessels in their eyes and then they just don't. It's a slow, insidious process for most of the issues that we're talking about. So that the screening really gives you insight into your body's health. And if you get screened and you get a result that is not negative, like they've detected there's an issue, the first thing you do is what we're going to talk about next, which is stress reduction in a little bit. But the next thing you do is learn all about it. What is it in your health that you can work on improving Is it your glucose levels? Is it your blood pressure? Is it your cholesterol levels? Is it quitting smoking or reducing it, right? You can look at the contributing factors and work on those processes to reduce the hit to your body, and look at what the providers, the doctors are telling you can help improve your health. It's not just well, now I have this, it's a lost cause kind of situation.
So now we're getting into really the lifestyle habits that can contribute to long health and prevention of complications, health problems down the road. You mentioned, stress reduction. That's a big part of it. Things like getting a good night's sleep. For most adults, 7 to 8 hours of sleep is best. There's always individual differences, but we usually gravitate to about that amount. But it's also sleeping with minimal disruption. People who wake up often during the night, that disruptive sleep doesn't let people get into a deep phase, what we call stage 3 sleep, where the brain really resets itself and gets rid of all the junk from the day prior. And it takes time to get from stage 1 to stage 2 to stage 3 sleep. And if your sleep is interrupted too often, you don't get enough time in that stage 3 phase that's so restful. So even if you do sleep 7, 8, 9 hours, if you're getting up frequently, it's not quality sleep. And there's a lot of strategies people can apply for getting a good night's sleep. But going to having a sleep study done if you suspect you're just not getting enough or your sleep is not of a good enough quality, sleep study centers do a nice job. They'll evaluate a person's sleep patterns and can give them some really good insight about how to get a better night's sleep. Sleep affects a lot of things, and I really developed an appreciation for it, having attended a lot of seminars on the impact of sleep on health. It affects us hormonally. When hormone levels vary, it's tougher to manage blood sugar levels. There's a lot of research showing that insulin resistance increases when a person's not getting enough quality sleep. And if our body's resistant to insulin, again, blood sugars are going to go up, become more difficult to manage. Our ability to make effective decisions and do the right kind of things when we're awake is affected by how well we slept. And we know that exercise is beneficial, but if you're not well rested, you're not going to have the energy or desire to exercise the next day. And making good food choices also comes into play, because people who are not well rested tend to crave all the unhealthy stuff, and we eat too much of that, it's not good for our health, our diabetes, etc. And the exercise is another thing that's extremely beneficial. And it's not just cardio exercise. For most people, it's also strength training exercise. As we age, we lose muscle mass, so doing strength exercise is pretty important. Maintaining the body's muscle mass, it's good for looking good, functioning well, but also preventing falls and injuries and things of that nature. And exercise plays a critical role in the body's sensitivity to insulin. A unit of insulin doesn't always work like a unit. Sometimes it works like half a unit. Sometimes it works like 2 units. It depends on how sensitive our body's cells are to insulin at any given time. And physical activity helps maintain a high level of sensitivity to insulin. Beside the fact that it helps keep us in good shape, help keep our weight down, help keep us functional, be able to perform all of our daily activities and tasks the way we want. For me, it makes me feel good. I just, I get a little bit of a high from my workouts, and I also find it knocks my appetite down. If I don't work out in the evening, I become sort of like a snack werewolf. I just want to eat everything in sight. I find it really helpful if I work out after dinner. It suppresses my appetite nicely through the evening. So it's like a drug for suppression, and it helps keep my stress level down. And you're going to talk more about stress, Tavia. But for me, the workouts keep my stress level at bay pretty nicely. You have any other good stress management strategies?
I did want to ask, because you said after dinner you like to exercise. Are there like other optimal times of the day that are best to get physical activity for managing or maintaining optimal glucose levels? Like
Well,
after a meal?
whenever it's convenient, that to me is the most important, when it's convenient for someone. But if somebody's ambivalent, if they don't really care about the time they exercise, they have lots of options. Exercising early in the morning can be really helpful. For one thing, people tend to stick with their workout plan longer when they do it first thing in the morning. But blood sugars don't drop nearly as much when someone exercises early in the morning. So they're less likely to have a low. They're less likely to need to snack beforehand. And for people who want to use their workouts to manage their weight, it's almost self-defeating to have to eat a lot of food beforehand. So working out early morning can be really helpful. If someone chooses to exercise after a meal, they have to be pretty careful about reducing their mealtime insulin to prevent a low, and even then it can still happen. But I would say, early morning, if someone doesn't really care, first thing in the morning is a really good time to do it. I'm not a morning guy. I'm like I don't really wake up, I think, until about 4 p.m. So for me to jump out of bed and go work out ain't gonna happen. So it's an individual thing.
Right. Yeah. So shifting into managing stress, Tavia, if you want to expand on self-care strategies to reduce stress and how to build those self-improvement habits in your daily life.
Of course. In my mind, the first thing you have to do if you're looking to improving your self-care habits related to stress reduction is first recognize that you are experiencing stress. Stress is it's like a catch-all word. It doesn't mean the same thing to every person. And in fact, there are a lot of other words you could use to describe stress. So for example, for one person, stress might mean what it feels like every month when they need to sit down and pay their bills. For another person, stress might be that daily commute to and from work with congested traffic and people not considering the others on the roadways, right? Like just having to deal with the onslaught of traffic and people trying to be in the same space as you at the same time is a different type of stress. Stress related to health concerns is another type of stress, and that might look more like anger or fear or isolation, depression. Those types of feelings might explain the word stress a little more clearly. So if you've noticed or if people have pointed out to you that you might be stressed or you're overstressed, first take a look. And if it's hard for you, then get some help with a counselor, a talk therapist, mental health care specialist, or a friend or a family member that you can talk through things and see if you can identify what the stressors are and how you're feeling about them. If you've never done this before, if this sounds like, sure, I'll do that, you betcha, I'll get right on it, lady. No worries, right? You don't have to believe what I say. It's okay. If you find yourself in a situation where you feel like whatever that thing is, call it stress if you'd like, is getting in the way of good self-care decisions. You're so stressed out, you're forgetting to take your diabetes medications. You're so stressed out that you can't stop to check and see what your glucose is. You're so stressed out that you haven't made any of your diabetes screening exams or taken that blood test that your doctor has ordered because you're just way too overwhelmed or way too stressed. That's a really good time to kind of put the brakes on just for a minute and take inventory. Once you've identified the key factors, and there's more than one thing that's stressing you the heck out. That would be pretty normal for most people. Once you identified the things and started to sort of identify and maybe name the feelings, that's when you can apply some strategies to help you reduce the stress. Now, the strategies may or may not reduce the actual stressors. For example, if your big stress of every month is paying your bills, unless you find out how to grow a money tree in your backyard, there's a pretty good chance that next month when you go to pay your bills, it will be equally as stressful as this month. So the stress reduction isn't necessarily about getting rid of the stress or avoiding the stress, although there might be some key things, like if you have an old friend who's more of a taker instead of a giver, and every time you're around them, you feel worse than you did before you were around them, maybe it's time to weed out the friends that are harmful to your health and aren't supporting your health goals. You've got somebody that every time you start your new walking routine, they give you a hard time and tease you about it and tell you it's not worth the effort. They know people have walked who are totally unhealthy. It didn't work for them. Do you have to talk to them as often? Do you have to hang out with them as often? Maybe not, right? So sometimes stress reduction means making a change to get rid of the stress or avoid it or not interact with the stressor as much. So there are different types of stress and different options available depending on what you're working on. Regardless of the stressors and the type of stress, there are some things you can do to help you when you've identified that you're feeling stressed out. For example, some really useful strategies that don't cost money, they don't take a lot of time, include working on breathing techniques and walking. As long as you have a pair of supportive shoes that you can walk inside or outside, then those are two things you could do really anytime. One thing you can do that can be free if you use the internet is looking for some free meditation sessions or some free yoga sessions. And you can also, if you prefer to be in person, there are many places, if you're in a metropolitan area, that offer in-person group meditation sessions or yoga sessions, for example. So we could talk more about the breathing part if that works for you, because I think most people know the idea if you breathe deeply, it somehow releases stress. So what I'd like you to do just for a minute, just hang out here with me in this stress concept. If you think of something really stressful, can you think of something? Can you guys both think of something that stresses you out? You don't have to tell me what it is. Can if you want to. Don't need to. It's your stress. I don't need it.
Or who it is.
Okay, so you've got your stressor. Think about it, and think about your last experience with that stress. What you'll notice in your body, if you're paying attention, is you do this. You hunch in. Your shoulders kind of get close to your ears. Your body curves in. Your spine curves in, and you clench a lot of muscles. And if you didn't in this 2-second drill, great, because you didn't really get to go through the full stress experience in our brief interaction here. But that's what our body does when it's under stress. And what we could do to change that is change our position. And one good way to do that is to take some deep breaths. So everyone knows how to take a big deep breath, right? One technique you can use to do two things. One, get your airways open, get air all the way down to the bottom lobes of your lungs. And by doing this, you expand your spine back out. And it helps you get your shoulders back down and release them from your ears. So this technique is called square breathing or box breathing. So it helps you do this, and it does it through repetition and timing. But the other thing the square breathing does is it takes your brain away from whatever it's concentrating on that's stressing it the heck out. So in your mind, you imagine a box or a square, color of choice. I like a blue box. Blue is calming. It's a calming color. So if you imagine a blue box or a blue square, and you start in the top corner, then you breathe in slowly for 4 counts. So let's do that together. And then when we get to the 4th count, you're going to hold the breath in for 4 counts. And then you're going to let the breath out for 4 counts as you move across the bottom of the box. And then you hold that breath out, empty lungs, for 4 seconds. So in for 4, hold for 4, out for 4, leave your lungs empty for 4. Okay, you guys ready? Okay, we're going to go in, 2, 3, 4. Hold those lungs full. 2, 3, 4. Out. 2, 3, 4. Leave those lungs empty. 3, 4. In. 2, 3, 4. Out. Oh, hold it. Don't go out. I lied. 4, Now out, 2, 3, 4. Hold it out, 2, 3, 4. And you can continue to do that. If you do that cycle a good 3 times, you're going to immediately notice a difference. Do you guys notice anything different? What do you feel is different?
I feel more relaxed. I feel a little looser.
Yeah. Do you feel anything different, or were you already totally chill, Gary?
No, I was stressed thinking about something that stresses me out. And then I kind of forgot about it because I was concentrating on my breathing.
Yeah. Right? It seems like
distraction.
It works for toddlers. It works for us too. Yeah. And so it does that square breathing specifically. It does it in 2 ways. One, you're focusing on the act of breathing in that very specific structured way. And you can think about the blue box. So it's one more layer of distracting you from that stress. And then also you're getting oxygen. When you're stressed out and all crunched up, you're actually deficient in oxygen. It's like short, quick breaths. You've got more carbon dioxide and less oxygen flowing. Your body needs the oxygen. Your brain really likes oxygen, right? So doing that just changes the dynamics in your body, and it helps blood flow. It helps release musculoskeletal tension. And you noticed right away that just the level of stress immediately reduces. We didn't fix the stressors, right? But we got ourselves out of our own heads, and we worked on our body position and getting oxygen to where it needs to go. So super simple.
People don't realize that when they're in a stress state, they're producing hormones that drive blood sugars up.
Yes.
When they're not in a stress state, those hormones aren't produced. Blood sugars are easier to manage.
Yeah.
And you can take 2 people, one in that stress, both of them in that same situation. If one finds a good way to relieve the stress, their blood sugar is not going to go up. The other ones will.
Yeah. So. Right. And you can see that. We see that a lot with our clients. We'll see when they go to certain places, their glucose just skyrockets. And they'll say, oh, you must have went to such and such place on Tuesday and Thursday this week. And they'll be like, how did you know? Because I can see your glucose is climbing. So,
right. Yeah. I've heard of that phenomenon if people like go to the grocery store or something like,
whatever it is that gets their stress levels elevated, right?
Yeah.
It could be going into a large group setting. It could be going into schools for kids, excitement or stress for kids as it may be, competing. So if somebody has a recital or performance, or they are going to try to win a wrestling match, right? That type of situation really can cause a change in glucose levels. And like Gary said, if you know these things are going to happen, one thing you can choose to do is to work on stress reduction techniques before and heading into those situations, and your glucose will look much different. It's pretty interesting to see. Some other things, meditation. Have you guys ever participated in meditation? It's okay if you say no.
A little.
So I will say, prior to the last year or so, I thought meditation was like just for special people, and I just wasn't one of those special people. My brain doesn't sit still that long. So the idea of meditation, one of the ideas is to sit quietly in a relaxed position and let your brain just sort of relax. Let it do its thinking, but not ruminate and not think tightly on certain topics and repetitively. And then to distract that type of acute, ongoing to-do list type thinking with the use of a calming voice, with breathing and posturing, with potentially some background noise or music, or a certain tone, like with a certain type of bell or a certain type of metallic drum, for example. And it's just interesting to think about how our body is so connected to the exterior world, where we largely ignore it unless we're too hot or too cold, right? Or we need to turn on a light because it's dark. We don't really think about how the outside world is influencing us. But it's interesting, if you've gone through a helpful meditation session, just that calm environment, the calming position, the different frequencies that they use.
Right. I was going to ask about frequencies. Yeah.
So interesting how it impacts our brain brain waves and our stress responses and our stress release. So there's a lot of interesting and newer, really not really new, but new to me, studies that have been done over the last many years that show improved stress reduction with some of these options that are available.
Mm-hmm.
And yoga, Tai Chi, those types of stress reduction options are great because you get the benefit of physical strengthening, core strengthening, and balance improvement, and helps with insulin resistance, right? Because you're getting that physical activity in, and the type of movements aren't typically rapid and acutely focused. They're slow and concentrated. So it gives you that ability to de-stress while you're doing it. You cannot do a lot of yoga poses without breathing deeply, right? You can try, but you're not going to stay in that position very long. And so yoga has a multifaceted approach to well-being and stress reduction as well. Many people with diabetes really enjoy, which is also a good thing, I think. And then walking. If you can walk, and if you can't walk, let's say, a lot of adults live with chronic pain. And so we'll talk about walking, and they'll say, yeah, and it is really more painful for them to walk than it is for them to not walk. So I'm going to say walking, but if you happen to be somebody who lives with very severe chronic knee pain or back pain or some other issue that prevents you from walking comfortably, then think of what could you do instead of walking that's physical movements that I'm not talking about sprinting. I'm talking about regular movement over a time period of your choice that gets you breathing, might even get you sweaty, but it's not the hardest thing you've ever done. But it's movement and it's on purpose and it's for a set amount of time. Studies show that if you even get outside, if it's possible where you live, to just go outside a few minutes and be in the outdoor world, it can help reduce some stress just from getting you out of your indoor situation and seeing that you're part of a bigger world. Mm-hmm. And part of that is the movement, and part of it is getting outside. Walking can help you manage blood sugars if done in conjunction with if insulin adjustments are needed, for example. And walking is a really great thing to do if you are not walking much. Then the good news is you can start small and just gradually build. And every step that you're taking helps you towards a larger goal. Mm-hmm. There's not a set amount of walking that everybody must do in order for it to matter for your health. It's all individualized, which is nice.
Yeah, walking has really been my jam in recent times. Like every lunch break, I'll take at least a 30-minute walk outside, and it just really gets the blood flowing. It's nice to get the fresh air. And also I had broken my ankle several months ago, so I couldn't walk for 3 months. So now I'm really loving it. But yeah.
Outstanding. Isn't it amazing? So you think at some point in your time you didn't walk at lunch at most days, right? Mm-hmm. And now how you feel compared to before, you didn't even know what you were missing. And then when you had to miss it, then you notice it's a hugely important part of your life, right?
Yes.
Wild.
Yeah, exactly.
Yeah.
So let's transition into discussing building accountability and maintaining consistency. So if you'd like to discuss the importance of maybe having a support system in building that accountability and maintaining consistency.
Of course. So we just talked about several different things that any of us could try if we're not trying them. And it sounds really good while we're talking about it. What's really easy to do as a human being is to have all these really great ideas up here and then not really put them into action. Mm-hmm. It's human nature. There is a theory that we are created to do the least amount of work, the least amount of energy expenditure is what our bodies and our brains are sort of programmed to do. This is the theory. So if it means it's hard or it takes time or energy, then it's pretty natural for us to be like, maybe tomorrow. I think Monday would be a good day to start that. Oh, it's raining. Maybe next Monday, right? One way to help ensure that the goals that you set will turn into a reality is to actually set goals. And goals is a kind of an older word. I don't think that people that are a lot younger than me probably talk much about goals anymore. I haven't heard that on social media for a while. Life plan, your action steps. If you know that you haven't been walking for 30 minutes a day most days, and you heard that today and you think, I should do that, I need to do that, and it's really important to you and you know why you want to do that, the best ways to make that happen, research shows, includes to write it down, to put it into some type of calendar or planner. So there's actually set times on specific days that you're aiming to do that activity. And share that information with somebody who will check in with you. Now you get to choose the somebody. Do you want to share it with somebody who will nag you incessantly if you don't do it? Or do you want to share it with somebody who might actually join you, like a workout buddy? Or do you want to share it with a friend who lives afar who's also working on a similar goal? Or it could be a different goal, but you guys can be action step check-in mentors for each other, right? Maybe I'm working on including more veggies in most of my meals, where maybe my friend is working on getting 7 hours of sleep each night. We can check in with each other. We can agree every week on Monday and Friday, let's just 5 minutes, or let's send text, whatever works for you, right? Having a person, whether it's a person, a group, it really, if it needs to be yourself, if you happen to be in a situation where you're living far from home and you haven't met people to interact with or something, right? Whatever the case is, having it scheduled, written down, and shared somehow, maybe to your higher power, if it needs to be, that this is your plan. And then have a check-in with yourself. In a week, did I do my action steps that I set out to do? Did I do them as planned? If I didn't, does my plan need to be adjusted? Do I need to be realistic and say, okay, 30 minutes of walking every day didn't fit into my schedule because I had meetings at lunchtime 4 days this week. Maybe lunchtime isn't the best plan for my work day. When could I get the 30 minutes in instead? Or I walked 2 days at 30 minutes and now I can't walk because my right foot is swollen and mad at me. Maybe I overdid that. Maybe I should start with 10 minutes and see how that goes next week, right? You can always adjust your plan if it doesn't work. As long as you're checking in with yourself regularly, as in, for me to do it, it has to go in my calendar, or I'll pretend like I'm going to, but it has to go in my calendar if I'm going to do it. Right. And then you can assess, did I do it? Didn't I? Why didn't I? Do I need to change it? Do I continue it? Give it another try. And another option you can do if interacting with other people about your fitness goals, sleeping goals, healthy eating goals, taking medication, action steps isn't super comfortable for you to talk about, you can also use different fitness apps. So lots of apps are available for tracking and for setting plans and checking them off as you get them done. And there's even a community behind a lot of the apps that you can read a little live stream of who's done what today and get some motivation that way as well. So those are some tips that I have.
I mean, there's something particularly satisfying in having something on your to-do list for the day and then checking it off. As simple as that. So
absolutely,
I definitely agree with that. And then Gary, how would you like to share some strategies for maintaining consistency in exercise routines, dietary changes, or other self-care habits?
Oh, Killa, there's a book that's very popular in the business world called The 10 Traits of Highly Successful People. Everyone's curious. They want to know what those are. But I think there should be a similar book, 10 Traits of Highly Successful People with Diabetes.
Yeah.
And I could probably come up with a handful, but what would be number one on my list is structure, consistency and structure. Now, I'm not saying that people with diabetes need to be robotic, exactly the same things every day. It's not the case. But I've found, being working in this field, being a diabetes clinician for over 30 years, I see time and time again that people who have structure in their lives are more successful with their diabetes management. Some of the things Tavia talked about in terms of consistency and structure, it really can go a long way. Things like sleep patterns, things like workout routines, meal and snack times. These types of behaviors, when they're done in a structured way, allow us to manage the diabetes better. And I think it also, there's a comfort that it provides us. It's kind of like, I love the show Fiddler on the Roof. They talk about tradition and how it helps them everyone keep their balance. But like you were talking about with your afternoon walks, how good it made you feel to do that. I have a tradition in the morning. I still get the newspaper in printed form. One of the last people to do that, I think. But I eat my breakfast, I read my newspaper. To me, it's a nice way to start the day. It's a tradition. I don't think of it as structure. I think of it as I have traditions that I follow on a daily throughout the day. And those traditions help me keep my balance. Psychologically, emotionally, helps me keep my balance. And from a diabetes standpoint, it's extremely valuable because you can learn how to fine tune your insulin and your medication around those structures. When things vary a lot from day to day, there's just no consistency at all. Diabetes is much more challenging to manage. And using exercise as an example, for a lot of people, if they work out after dinner from time to time, their blood sugar is going to plummet. They'll drop overnight. But because I do it consistently, I've learned how to manage it. You learn how to manage things when you're doing them repeatedly. We get good at stuff that we do on a repetitive basis.
Yeah, and you forge new neural pathways in your brain.
Something like that.
Yeah.
Yeah, but when I'm looking at patient data, if their meal schedule and their snack schedule is totally inconsistent, and I'm not talking about what they eat, but more when they eat, that really it's tough to figure out how to manage the blood sugars, how to fine tune the doses around something like that. But if things are more structured, it's a lot easier to manage. Another thing I think adds to structure, and Tavia suggested this, are reminders. We got a lot going on in our lives. Reminders can really help us to stick with doing certain things at certain times of day. Mm-hmm. But getting back to what I talked about earlier, with all those labs and exams, there's a lot to remember. We put together a self-care card for anybody with diabetes, and it lists on it the labs that should be done, how often, the exams, and people can keep track of when they do these things. So I wanted to offer this to anybody who's listening in. They can email me or our practice, and we'll be happy to send them a free copy of this, either by mail or electronically. So they can either email Gary at integrateddiabetes.com or info@integrateddiabetes.com, and we'll be happy to send that out to them.
That's such an amazing resource. Yeah, I was wondering, and I wanted to ask that earlier, if there was some sort of list of all of those exams. So that's a really great resource. So we don't have any questions in the chat, probably because you both have been so detailed and all-encompassing in your information. So yeah, I just want to ask, in the last couple of minutes, maybe Tavia, do you have any closing thoughts that you'd like to share?
In summary, I think it's important to recognize that at different parts of our lives, we will have a variety of things, competing priorities, as they might be called, that may influence our ability to carry out what we intend to carry out with regards to taking excellent care of our self-health. And so if you get into a rut, or you go through a period of time where there just isn't even a second in the day to really do the things you intend to do for your health, it doesn't mean it will be like that forever. And that as soon as it's possible, even just doing like the breathing we talked about can help you to get through whatever that super stressful time might be until there is a little more time and energy available to concentrate on your health related needs. And that it's totally human to feel all sorts of stressed out or overwhelmed or whatever emotion you're feeling at any given time. And living with diabetes, it is expected and normal to have a big variety of feelings when it comes to thinking about living your life with managing diabetes. And it doesn't all have to be happy and positive and I accept the challenge, move forward. It makes you human to feel however you're feeling at the moment and not to beat yourself up about it. If you're feeling negatively about your diabetes, try to get someone to interact with and find some coping strategies and some stress relief techniques to help you so that you don't have to feel all the negative stuff all the time intensely.
And how about you, Gary? Any closing thoughts?
I think back to what I said earlier about most people take better care of their cars than they do themselves. Reverse that. Take at least as good a care of yourself as you do your car. Preventive health matters. Now, there's going to be a cure for diabetes at some point. We won't have to worry about this. But when that cure comes, I think we all want to look back and say, you know, I did my best. I didn't underserve myself. You know, I took care of myself. I managed my diabetes the best I could, and I practiced preventive health. So if things happen, they happen. You don't want to have regrets. There's a big difference between losing your eyesight and having a microvascular thing detected during an exam that can be fixed. Yeah, you want to, when that cure shows up, or even if it doesn't show up, we want to be in good shape. We want to be able to live a full, healthy life. A little bit of preventive health can really go a long way.
Absolutely. Well, thank you both so much for joining us today. It was such a great discussion with so much helpful information. I just need to reiterate that today's discussion is for informational purposes only. Consult your healthcare provider for personalized advice. And I look forward to having the both of you back for another discussion like this in the months to come. But yeah, great strategies, great advice. And we have the email to reach out to Gary for that amazing chart in the chat. So if you'd like to reach out to him for that great resource, just look to the chat for his email. But thank you both so much again. And everybody.
Thanks, Kayla. You're a great host.
Oh, thank you. All right. Everybody have a great day.
Thank you. Bye.